Hi, I'm Irlam for the Victorian Gay and Lesbian Rights Lobby. Here tonight at Hares and Hyenas, thanks to starobserver.com.au and pridetv.com.au, we're doing a Meet Your Candidates forum for the Victorian State Election 2014. Let the candidates introduce themselves to you, and we're going to then have a question time, 60 seconds to respond, and then we're going to go into a bit of discussion.
My name's Kathleen Maltzahn and I'm the Greens candidate for Richmond.
Neiil, Pharaoh, the Labor Party candidate for Patten.
My name's Shannon, Eeles, I'm the Liberal candidate for Albert Park.
And I'm Fiona, Patten, and I'm the Sex Party candidate for the Northern Metro region.
So we're here to talk about LGBTI health and wellbeing, and there are so many different topics we could talk about in sort of an hour. We saw recently that there was a report from the Victorian Parliament on the increased use of ice in our community. We know about the mental health issues. We know about lesbians being slightly more overweight than the rest of the population, increased rates of obesity and smoking in our community. What can your parties do about the health issues that face my community?
My partner was recently diagnosed with breast cancer and we have had amazing care. She's had amazing care, but very early I was reminded of this issue of different treatment where we fronted up for her first session of chemotherapy. The nurse started describing what you do after chemo when you have sex and realised she had nothing to say to us. And in all the materials that have come through, we've been entirely invisible. And I know that that has been replicated in countless ways. And there are a whole lot of things we can do about that. One, we need funding for the community organisations who are researching and responding to these issues. We need political leadership so that when people are being bigoted and violent, our leaders stand up and speak out about that, and actually marriage equality is really part of that. We need the end of discrimination so that again the message goes to the community that we're full members of society. And we need things like the Ministerial Advisory Committee looking broadly at issues so that we have the voice of the community in government discussions.
Neiil.
Excellent. Well, look, I think there's a number of key concerns across the LGBTI community when it comes to healthcare. One of the biggest concerns that I've heard recently is actually the impact of the federal and state government Liberal cuts on the LGBTI community. Now, it's great for our members of parliament currently to sit there and accept a $7 co-payment, but if you're someone with HIV or complex care needs, that's multiple visits across the year. Even as a gay male getting tested at a sexual health centre, all of a sudden it's not only a co-payment when you visit, but a co-payment when you return. And this has been illustrated again at state level, where we've seen ambulance waiting times blow out, hospital waiting lists blow out, and they disproportionately affect the LGBTI community further as a community that is not quite equal in health and in other areas. And that's a big concern that I have. The second concern I have over healthcare issues is that while we had a great conference with World AIDS 2014, Labor Party is the only one of the major parties who has actually adopted the action agenda out of World AIDS 2014. It's great to agree to some principles, but it's really important to follow that agenda through. Likewise, we've had 4 years of the current government where we've had no expansion of our PET program, which is a big risk. Why is it that in Victoria only 3 or 4 locations have PET, New South Wales has over 50? That's not good enough, and Victorians deserve better.
Shannon.
There's the issue and I guess the increased incidence or the greater number of people in the LGBTI community with mental health issues, with illicit drug use, HIV. You're talking about the increased incidence of cancer. It's really, really concerning. There's a number of initiatives that the Maltzahn government are currently supporting, like the Vic AIDS Council, the Living Positive Victoria, recent announcement of $5 million investment into youth mental health. But also probably most important and significant right now at this time is the Victorian LGBTI Health and Wellness Action Plan, which has just recently been released, and this was in conjunction with the Ministerial Advisory Committee and also significant community consultation that went on. And the actions, if this is available online, I can't explain it all in 1 minute, but it is available there. But looking at how do we act better, how do we understand more about what's going on, and a very clear framework plan for the next 4 years.
Well, we'll put a link to that on the bottom of the video when it goes online. Fiona.
I think one of the really strong areas that I've been concerned with is mental health. And mental health is underfunded across the board. But because our community is impacted by mental health, some say even 3 to 4 times at a greater rate to the rest of the community, that's what I think we really need to start focusing on. And we need to look at the implementation, and it's very pleasing to hear the Liberal government talking about this. We also need to start with education. And Our sex and relationship education is woeful if it exists at all. And if we start with this kind of relationship and education and sex education at a very young age going through our schools, we can really address a lot of the issues around homophobia, certainly a lot of the issues around STIs, and we can improve things like domestic violence that affect our community as much as the general community. We can address all of those issues. But I do think from my perspective at this point in time, it is the mental health issue that leads to, that is also very much related to our higher incidence of drug use or drug misuse in our community.
And mental health is a big issue, but we've seen a lot of programs focused on that. We haven't seen a lot of things happening on smoking or obesity and things like that. What can we do to sort of take the mainstream part of the pie and actually tailor it, like you were saying, to the LGBTI community, so it's not so, for lack of a better word, heteronormative in everything that we receive?
I think there's a couple of things, Corey. I think that you need specialist agencies funded to go out and do education and to hold mainstream organisations, whether they're government or community, to account. And we don't have that at the moment. And the best organisations doing the best research can't make things happen without that support. And I think we also need those political messages about equality that actually make other organisations think we've got to take this seriously. So looking at the Human Rights Charter and including GLBTI rights in there would be a start. And that will, sorry, you're winding me up there, that I think makes a difference.
Cool, sure.
Yeah, I think that again, involvement from the community themselves and the community consultation process is so very important. Peer-led initiatives like the rapid, sorry, I'm going to use the right words, rapid HIV testing centres that are peer-led, I think are really important, and engagement with other people from the community.
Yeah.
I think the most disappointing thing we've seen in health and this string of LGBTI announcements, including the most recent one, has been an inaction for 3 years by the current government, led to a rush of announcements in desperation in an election year, whether it be expungement, whether it be a whole heap of other policies that were often copied off the Labor Party or other political parties, all announced within days of an election, I think really shows the discontent that the current government shows towards the LGBTI community. And that extends into the Hay grant arena, where a large portion of that money that was allocated is rehashing of existing funding. It's not showing a genuine commitment in healthcare or healthcare reforms.
Are you matching their $5 million?
I haven't looked into what our budget commitments for the LGBTI space are yet, but we will be doing an announcement close to the election on an LGBTI policy platform.
Should we get a camera out there? Fee, final word.
I think peer education was a really good point that you brought up, that you looked at that the ICE advertisement we've been doing, blanket, but we know that we did not do any peer education into our community on this. We've seen clubs going, right, we're just going to prohibit people from entering our clubs and ban them for life if they're using it, but we need to be treating this as a health issue and we need peer education, and this was a perfect opportunity where we could have developed a very targeted campaign to our community on ICE in particular.
Well, you've been listening to Meet the Candidates Forum 2014 here at Hares and Hyenas. Thanks for tuning in. We could be talking all day about health and wellbeing, but tune in next week and we'll be talking about something else. Bye.